Welcome everyone tonight to Unified Therapy Services Parent Power Presentation on Medicaid Modernization. We will first start with some introductions. My name is Kelly Heisinger and I am co-owner of Unified Therapy Services. Tonight I will be presenting along with Sarah Severs, who is our director, and Debbie Paxson, who is our office manager and lead billing specialist. As our slide states, we are not Iowa Medicaid enterprise employees. We don't work for the governor. We work solely here at this facility and for this facility. With that being said, the three of us have spent countless hours reading, researching, attending the member meetings, attending the provider meetings, attending the stakeholder meetings, meeting with Senator Pam Yocum face-to-face, reading, and asking for more information. We want to be as informed as possible about what's going on, and we want to be able to offer all of you as much information as we know. If you have a question and we don't know the answer, we will try to find out and we will try to get back to you as quickly as we can. We may have questions that won't get an answer, so just be aware of that too. We've already asked several questions and are still awaiting responses to our own questions.
Okay, so we're just going to start our night out just going over some of the goals that we have for tonight's presentation. And the first thing actually we're going to do is just define Iowa Medicaid's new plan, the Iowa Health Link. Just show you guys the logo as well for the people that want to know when you have some mailings coming in. This is what it's going to look like. Please don't disregard them. Please open them up immediately. We're also going to just talk and describe, give you some contact information about the managed care organizations that were chosen. And we're going to review the implementation timelines and give you some times of what needs to be done by what date. We'll also provide you with additional contact information, which is attached to this PowerPoint presentation with Legislative Senate, Iowa representatives, Medicaid information, contact information, our information as well. And then, like Kelly said, we're going to open it up for questions at the end. So the new plan, the governor obviously has issued this plan. The official name is the Iowa Health Link. And obviously you'll also hear it being called Medicaid Modernization.
Everyone's question is, why is Iowa changing Medicaid? Here is what we have been informed. Medicaid currently provides healthcare assistance to over 560,000 Iowans. Currently, that costs $4.2 billion annually. The cost of delivering Medicaid services has grown by 73% since 2003. They anticipate another 21% growth in cost expenses over the next 3 years. Therefore, a reorganization of Iowa Medicaid is intended to improve the quality of healthcare and provide greater accountability for outcomes, meaning what we provide, what us as providers provide to you, that they are going to measure our outcomes and make sure that we are delivering quality healthcare.
We have some spots in front too. Sorry, not to...
Everyone on the left are included Iowa Medicaid members. So, members who will be affected by this plan. The majority of traditional Medicaid members, those on Hawkeye, those on Iowa Health and Wellness Plan, members involved in long-term care, home and community-based waiver services, and the medically needy. So, which is the majority of those 560,000 people. Excluded meaning that they do not have to participate in this change to Iowa Health Link is the Program for All-Inclusive Care for the Elderly, which is typically referred to as PACE. Programs where Medicaid has already paid premiums, such as if you're in the ZIP program, or if you're eligible for the Medicare Saving Program only. There are obviously undocumented persons that are only eligible for short-term emergency room services. They're undocumented, really don't know where they are, so pertaining to most of those that are homeless. A little bit harder to track down, so they may be excluded just for the fact that are not documented in Iowa's current Medicaid system. And then all dental benefits under Iowa Medicaid is staying with Iowa Medicaid.
I just want to go over the HIP program. Debbie, she's our billing office manager. So she is actually going to contact all of our current patients that have Medicaid as a secondary to talk to them about that HIP program.
Yep, I have a application and then just a brief letter kind of explaining what it is. You're not guaranteed that you're going to be covered on it, but it's definitely worth trying to get them because they will help pay for your Blue Cross Blue Shield or whatever your commercial insurance premiums. So it's worth filling out the application, and the deadline is really by the end of this year, so we're kind of at the last crunch here. So anybody who has a commercial insurance and Medicaid, if you want to see me afterwards, then I'll have the application information. Yeah.
So again, it's Medicaid pays for the premium of Iowa Medicaid, like
And it's
the
just a
Iowa
Medicaid
services.
application, so.
So what this means is basically those people are not going to be included in the MCOs. They don't have to choose an MCO. We will continue to bill Iowa Medicaid for a fee for service for those clients. So we're asking everyone that currently has Medicaid as a secondary to try to at least qualify for this HIP program, and there's qualifications that you have to
meet certain qualifications.
I have my son is the patient here, and I have got a health insurance program, and his secondary is on the Medicaid. Will he still be eligible for that because I pay for his premium?
There's some qualifications that you have to meet with DHS, but we'll give you the application that you can fill out and definitely try to get them to help cover it.
Debbie, this does not include Medicare.
Correct.
As standard,
Correct.
Commercial.
Medicare is not involved. Yep, it's just commercial, like medical associates, Blue Cross Blue Shield, Walmart, Health Partners, any of the
United
commercial,
Healthcare,
United
Cigna.
Healthcare, Cisco, things like that.
Currently, Iowa Medicaid Enterprises, or IME, and its subsidiaries such as Magellan, facilitate healthcare and healthcare reimbursement for Medicaid members across the state of Iowa. What is going to be transitioning through the Iowa Health Link, aka Medicaid Modernization, is that Iowa has selected 4 managed care organizations. We abbreviate to MCOs, so you'll hear us say MCOs a lot tonight, to replace the majority of Iowa Medicaid Enterprises facilitation of these services. And so, instead of Iowa Medicaid facilitating everyone, they're taking that and breaking it down to 4 different companies to be doing what Iowa Medicaid is currently doing.
And Iowa Medicaid will still continue to be at the top of the chart. It's just, again, like she said, that organizational chart is just being brought down to these 4 MCOs. Sometimes, we just want to let everyone know what is managed care. A managed care organization, or the MCO, is a health plan that coordinates care for a member. Each one of these MCOs will provide a network of providers across the state of Iowa. MCOs set the guidelines to assure appropriate services are provided at the right time, in the right way, in the right setting. We're going to go into a little bit more specific information here in a couple slides. But the 4 MCOs listed here, the first one is AmeriGroup. We provide you guys with the website and the phone number for each MCO. And then there's AmeriHealth, Cardis of Iowa, which is actually a partnership with Blue Cross Blue Shield of Michigan. And then there's WellCare of Iowa, and then United Health Plan of River Valley. So those were the MCOs that were chosen.
In your packet, there is a 1-page printout of the 4 MCOs later on in the packet as well.
And we'll probably also discuss it later as well, but there is actually a comparison chart that it will be available online soon. It is not available right now, but it will be available, and it also will include an MCO directory of all the providers. So again, the last meeting that we just went to last week, this will be happening. It's not currently on the website right now. But as soon as we know, you guys will know, because when you provide us with your email list, we can kind of start an email blast You know, just of updates that we receive, important updates. It won't be a lot of emails, but I just really want to kind of stay informed and update you guys as we get updated. I'm sure you guys aren't looking at it like us every 5 times a day. The next thing on here is the timeline for implementation. So first I want to talk about the introductory letter that everyone should have received. This is an example of what one looked like, and it was intended to be sent out in October, actually September, and then got pushed back to October, and then people pretty much got them in November. So my biggest thing, if you would walk away from this meeting, is to actually know, please contact Iowa Medicaid Member Services to update your address. You may think they have your address and it's correct, but literally it took us 3 years, I think, from moving from that building to this building for them to actually get the correct address. Some of the information had our correct address, some of it didn't, so I highly suggest just to re-verify to make sure that they have it. If you received your introductory letter, I'm sure that they obviously have your information, and then there's the number attached for that if you need to call them for that.
Can we just get a show of hands who did receive a letter? Okay, and then who did not receive
One for each.
Okay,
Thank you. Now the timeline for enrollment packets. So packets are going to be mailed out at different times. Everyone should receive them by November 30th per Medicaid. So again, like the introductory letter that was supposed to be sent out in September and then pushed back to October and then finally in November. Same with this, you know, currently right now everyone should receive that by November 30th. And your enrollment packet will contain a pre-assigned MCO. So if I'm going to pretend Kelly is the Medicaid recipient. So Kelly receives this and she says, Kelly, you're assigned to United Healthcare of River Valley. And so Kelly now still has to complete her enrollment packet and send it in. But if she doesn't, she still will be pre-selected with that United Healthcare of River Valley. And then Kelly will still have the choice to choose between the 4 MCOs. So she'll review the enrollment packets of each MCO and then make a decision. If you have any questions while reviewing that information, obviously Iowa Medicaid Member Services will help you. You can contact us and we can help you as much as we can as well. One of the things that was frequently asked is auto-enrollment of your family. You have a family of 4 and they will select the pre-assigned for all your members in your family.
They will try to keep that to 1 MCO. So if your household has 3 Medicaid members, they're going to try to auto-enroll you into 1 MCO. Again, you do have the right to change that, but that's what they are telling us, how the auto-enrollment is going to initially start.
So let's just say that I have two kids, and one of my children go to University of Iowa and one of my children go to Unified Therapy Services. If those 2 providers are contracted with different MCOs, I do have the choice to choose 2 different MCOs for my children, or I can choose both for the same. The pre-selection is just so that everyone, if they have a wrong address, if they didn't respond, that everyone still continues to have coverage throughout this whole transition. So that's the reason for the pre-selected one. And like I said, so I just review, choose, and enroll.
Excuse me.
Yeah.
You said everyone will have coverage through the transition. So can I elaborate? And after the transition, it's also complete to the. I expect it to continue, right?
Yes. And we'll get to that too here in the next slideshow. The timeline, this is just another kind of a different Excel list. Just December 17th, 2015 is the last day to make an MCO choice for January. So the question is, yes, they do expect you to make a choice by December 17th for the coverage to begin January 1st. If you do not, then that's why, again, that pre-selected one is chosen for you. And then January 1st, your new coverage with the MCO begins. And then March 19th, so between December 18th and March 18th, the member can change the MCO without good cause. So throughout this whole time, so the next date to remember is March 18th. So you have until March 18th to change your mind for any reason at all. Now, after March 18th, then the member must have good cause. And the reason for good cause would be, you know, for example, if my provider is not in network. And we're also going to get to that in a later slide as well. So this is how you can contact your MCOs, the next slide, by a live person by the phone. Again, that's within our contact information at the last page there. And then in person, there are the member educational meetings that are held throughout the state. So in the last, again, meeting that we went to, the representative did state that if there was enough, you know, people requested for them to come back, they will come back, is what she told us. And they will meet with you if someone does need to be met with. And like I said, you know, you must turn in your enrollment forms even if you're not switching. So they will give you a pre-stamped envelope with the enrollment packets. And you can also email it, fax it, and again, in-person meetings as well. So what does this mean for members? Okay, so members will have 2 cards now. So you will still have your Iowa Medicaid insurance card, and you'll continue to have that card. New members will still receive that Iowa Medicaid card. So I'm going to use Debbie as my example. So Debbie is new to Iowa Medicaid. She's just going to try to apply for Medicaid assistance. So she will receive a Medicaid card through Medicaid. The application is still through Medicaid, and then she will make her choice for the MCO, and then she will be given another MCO card. The MCO enrollment begins on the 1st of each month. So if you have, so she won't be eligible, so if she tries to apply January 15th, she actually won't be effective with the MCO until February 1st. But she'll still have that Iowa Medicaid insurance card to hold her until the MCO takes over. She'll still have coverage. It just depends on what insurance card you're going to hand to your healthcare provider. So I would suggest just bring both all the time with you. No changes to current Medicaid application or eligibility process, including waiver lists. Applications continued, like I said, to be processed through DHS via phone, online, or paper. Eligibility is first made by DHS, then the member is enrolled in the MCO. Any questions about benefits or providers, you know, contact the MCO. Any questions about changing your MCO or any issues or concerns, contact Iowa Medicaid Member Services.
This next slide we did take from one of the meetings from Iowa Medicaid. So this is what they posted about answers to some of the most frequently asked questions. Will eligibility for Medicaid, Iowa Health and Wellness, and Hawkeye change? They say no. Will members get to pick their managed care entity? Yes. If they don't, they will be already auto-enrolled like we discussed. Who will the members contact with questions about their specific services? You will contact the MCO you are contracted with. Who will authorize services? So that means if you need a prior auth, treatment plans, things of that nature. The MCOs based on our state policy. Will service providers be the same as they are right now today? Yes, for at least the first 6 months. You can still continue to go to your current providers through June 30th of 2016.
Go
ahead.
I was just going to say, that is the information that I feel like the majority of people do not know. I know there was concerns with someone stating, you know, I'm going to have to make a decision, and then my providers aren't in network, so now what? January 1st comes along, you know, and please be rest assured that now you can educate your providers, healthcare providers, to state I know that Medicaid is going to pay you the same as normal until June 30th. So nothing will change for you guys until June 30th. So that's just a key there.
What will be the change after June 30th?
That is the question of the night. Thank you. We don't know. So we're going to discuss it a little bit further tonight. So we have to contract, or we have to read all of the different MCOs provider contracts that they have submitted to us. They have given us their preliminary rough drafts. I cannot tell you today if what I sign is going to hold through, or if July 1, they're going to send me a new contract in the mail with new exclusions, new rates, and then I will have to again decide I will continue to be in network with them or not.
So you are saying that after July 1st, services can change because of the MCOs.
I am saying starting July 1st, the providers that if you want the services covered by Iowa Medicaid, you must go to a provider that's in your MCO network. You no longer can go to just anyone that's an Iowa Medicaid provider. You would have to go to a provider that is listed in your MCO network. Does that make sense?
And a representative from the MCOs did comment, because I had asked the same question, and I stated, what happens to Kelly when July 1st comes around, and then we did not choose United Healthcare. We did not choose the MCO that she's in. So they had stated that they potentially may be coming up with out-of-network rates. So again, now we're looking at, as a provider standpoint, not knowing what the current rates are now, and then not knowing what the out-of-network rates will be either. So I don't know where that falls for the members' responsibility for being responsible for any of the payment. But more to come. That is our top question to find out.
I think our second most frequently asked question is the next bullet point. If a member has a case manager, can they keep the same case manager? Iowa Medicaid is telling us members will have the option of keeping their same case manager for at least 6 months, meaning January 1 through June 30th of 2016. Then it is up to each MCO whether or not they want to hire DHS case managers that are already providing those services here in Iowa, or contract on their own, or use case management that they already have in place that they utilize in other states and other areas.
And another thing about that, unfortunately, some case managers are already trying to find other employment, not knowing what is actually going to take place, and if the MCOs will choose them to keep their local DHS here.
I had a meeting with our case manager yesterday, and I do know that our big case management here in Dubuque is going with the AmeriHealth Paratus. They have signed with that.
Thank you for that information. That's the same information I heard too. I just didn't want to say it in case that other person, but that's great to know.
Will there be appeal rights? Yes, members will be able to appeal to the MCOs just like you appeal to the state today. What we say to each and every one of you is once you get your enrollment packets, when they come in your mailbox, as painful, awful that it may be, to please read through, dissect, underline, highlight, ask questions, figure out what this means for your loved ones so that you are as informed as possible about continued care starting in 2016. Things that we have been reading through when we're reading through our contracts are diagnosis exclusions, co-pays, therapy caps, treatment plans, or prior authorizations. Now, we deal with all of those things on the commercial insurance side on an everyday basis, but this would be new to those that currently have Iowa Medicaid services. So those things aren't in place for Iowa Medicaid today and will be based on each individual MCO starting in 2016.
So basically, starting 2016, we have to pay, there will be co-payment and other things.
It depends on which MCO you choose, and there are different ones that have, one might have a copay, one may not have a copay. And the copays are $1 or $2. So, and again, you know, everyone is different. And also our provider manuals, which is actually listed as well later, I think, they actually just came out on October 27th, and that was only the draft version. So one, they didn't have all the information for us to read. Two, it was only draft version. So we do have to put a disclaimer on everything we state out of the provider manuals that we print, because again, it's on draft version. So potentially, if enough people voice their concern about not having a diagnosis covered, then potentially they could change that. And we are in the process of writing a formal letter of all of our concerns with all those exclusions and copays and et cetera, and treatment plans and prior authorizations, to email then the underwriters of this, because some of the other things that are unmentioned are, you know, the autism program, the ASP program through Magellan,
Consumer choice options. Some of the contracts don't have home and community-based servers, waiver services listed in them. So they are not the same. They are 4 completely different contracts in every way that you can imagine.
So those are the things that we point out that we know as our members have these specialized programs, and, you know, things that we're going to write to them to make sure that they get addressed.
Here's just another example about the fact that we have been informed that reimbursement will remain the same through June 30th. So, example 1, Kelly, me. Let's say I have the MCO WellCare of Iowa. I come here to Unified Therapy Services on May 1st of 2016. And Unified Therapy Services is not a provider, not in network with WellCare. My services here will still be covered. WellCare will still pay Unified Therapy for the care I receive here. Now, same situation, but let's say I still have WellCare and I come here August 1st, so we're after that June 30th deadline. And let's say Unified Therapy Services is still not a provider with WellCare at that time. It is not yet determined if the MCOs are going to have what you call out-of-network benefits. So if a provider is not in a network with the MCO that you're assigned to or have chosen to be in, that you still could potentially go to that provider with an out-of-network benefit, meaning that there will probably be a small cost to you. That is still part of that old draft contract that hasn't been finalized yet. Or there may not be an out-of-network benefit, and if I were to come here August 1st, being with WellCare as my insurance carrier, I may end up having to pay for my services here. Well, who cares that I've been coming here for 6 years and it's the best place on earth, right?
Next, we actually have some CMS listening sessions. So here are the ones that are coming up that are still available. Providers we have, which is actually tomorrow. And then we have the phone number to contact, and then the conference ID number to contact. And then consumers and advocates, November 19th, the phone number, conference ID number. And then this is a great way to do an outreach contact list here. Just follow the link that we have here. And for this invitation, then you can add your email address to get these links.
So is it a conference call? Or?
To voice your concerns. Pretty much it's a, so they have it set up to the last conference that I listened in on, is basically the representatives kind of did an introduction, and then parents or members or providers or advocates kind of voiced their opinions and concerns. So that way they took those back to the people that are making these decisions and saying, here's what I'm hearing, here's the concerns, pretty much advocating for the unreadiness of this program.
really going to take 1.5 hours, or can we come with like a half an hour thing? They will be here for 1.5 hours. Or what? Because it says
2 hours of
One-
plan for.
no, it's 1 to 2:30.
Oh,
And
yeah.
you can call in at any
Anytime.
time.
You can call.
Yes.
Mhm.
Yeah.
Anytime within that time frame.
They tried having these last week. I don't know if any of you tried to phone in. We did. There were some technical difficulties. There was so many people calling in. It was just hard to facilitate a conversation that way.
I tried to call just to ask them a regular old-fashioned question about normal Medicaid today, hung up after half an hour of being on hold. Like, I don't have
So it will be easier to come here as well.
Oh, and sorry, we're not
It's not
having
here,
it
no.
here, but you can
Just
just
call
call in
in for any phone
wherever.
where you're at.
Yeah. Mhm.
Okay.
Yeah, we did it last week, so there was just a lot of, I hope by now they have a queue where they know who logged in first to speak, but before there was like just hundreds of people trying to talk at the same time.
I am sure all of you are probably sitting out there going, my loved one has a primary care physician, or a pediatrician, a cardiologist, an orthopedic specialist, PT/OT speech, home health care, DHS case management, respite care, 2 or 3 other providers that maybe I'm not aware of. So I don't know how many I just listed. 8, 9, 10. So how are you expected to figure all of this out and navigate all of this? It is November 17th as we speak. So Iowa Medicaid, when we go to our meetings, this is what they say. They say, inform the members to contact all of their current providers and see if they are in network with each MCO. Has anyone tried to do that? Will you want to share your experience?
All my doctors say they have no clue what's going on, and that's exactly what happened.
Yes.
That's what you said.
Yes.
And that was up today.
Today. Okay.
Lily's eye doctor, 2 episodes, they were not signing any of them.
So I think what we could do, so most of this presentation has been, like I said, what we've gathered from Iowa Medicaid. Now we want to go into what we've gathered on our own. And I think this is going to be a little bit more enlightening. So Sarah mentioned these provider manual drafts that range from 60 to 200 pages. We just received them on October 27th, and they are still in draft form, which means, do we still have the right to negotiate? Can we say, you know, no, we're not going to be in network with you, because by doing that, the quality of care that we are currently providing to our patients will be restricted. So those are our questions. These long letters. These are our highlights and our scratchy notes all over everything that any negotiation process. Has anyone bought a car? I mean, it doesn't just happen in 5 minutes. There's negotiations back and forth.
And then how am I, again, supposed to tell Kelly that, I'm sorry, Kelly, you only have 60 visits for physical therapy, you know, when she's
When it wasn't limited before.
when it wasn't limited before. And the biggest concern that I have, that I've shared at the meetings as well, is they continue to stand up there and say that the coverage is going to continue to be the same, and I continue to raise my hand and say, no, it's not, because I've read the provider manuals, and you clearly state in there that it's only, you know, some of them only have 60 visits, you know, per year for therapy, or now you're having a copay, or now you're asking me to send a prior authorization in on this child that has developmental delay, which I know now that you're going to deny, because previously Medicaid would cover it, but now you're stating that you're going to deny this because it's not an exclusion. Now it's an exclusion because they have to be born with some
Horrific
Yeah.
to be covered.
So that's why you're getting the answers you are getting. As much as it is so frustrating to you, I want each of you to know that I feel like in my heart of hearts, us providers, 1, it is a lot to decipher and figure out. 2, we don't want to sign anything if it means quality of care is going to be diminished. So, CMS, Centers for Medicare and Medicaid Services, has not yet given the state of Iowa the final approval to move forward with this change. This is why you do not have your enrollment packets. You will not get your enrollment packets until CMS has approved, has given the final stamp of approval for the state of Iowa to move forward.
Is that federal? What is that?
The Centers for yes.
Have other states done this?
Yeah.
Yes.
And gotten approval?
Yes.
With
Kansas.
similar programs?
Yeah.
California.
Kansas, California. Okay, so
But never of them, which I just read in that letter, have ever moved this quickly.
we have read some of CMS's readiness plan. It's like a two-tiered plan. CMS wants the state of Iowa to provide documentation that XYZ is ready for implementation. And then after they approve that, then they're going to give us another list of things that the state of Iowa has to show that they are ready for before CMS will approve this to go forward any longer. Now, the list is long. This is just a few things. CMS requires a smooth transition. I don't think right now they can agree that this has been a smooth transition. CMS wants to minimize negative impacts. I think everyone's stress level in this room is 9 or 10 these last few weeks hearing about this. They want to make sure that there's a significant number of staff hired and trained by each MCO. I can't answer if the MCOs have hired and trained additional staff to take on 560,000 islands.
To add on to that, especially the ones that write the manuals, because of the fact that they don't have everything in the manuals currently right now.
One of the things that I feel is most important for CMS to give their final stamp of approval is the majority of current Medicaid providers have to sign on as in-network with at least one of the MCOs. Can you maybe draw a circle and connect the dots? We're not signing yet. If we don't sign, CMS isn't going to approve. If it doesn't get approved, it can't start January 1. Does that make sense?
If it doesn't start January 1, then it's wait till next calendar year.
That is
That's
the
up in the
question
air.
again too.
Yep. So, personally, if change is right, fair, and just, I am okay with change. We work with our patients here every day, and we work on change and accepting change and tolerating it and be able to communicate and move through your day with the thousands of changes that happen. So if this change is right, fair, and just, I am okay with that. Right now, we're not at that point, and right now it's moving too fast, and there's not enough answers. So what are we going to do?
So if we receive a packet, does it mean that CMS has approved it?
Did you get your packet?
If we receive
If you receive your enrollment packet, will you bring it in? It means CMS has approved it. CMS. So Senator Pam Yoakum was here for 2 hours yesterday, meeting with my business partner and I. And we asked her, we said, Pam, when do you think CMS is going to tell us something? When are they going to say, yes, Iowa's ready, or no, we need to delay this program 6 more months? Pam's response was, CMS's initial information to the state of Iowa was that they would make a decision approximately 90 days from the date it was submitted to them. It was submitted to them right around Labor Day, so right around September 1st. So that puts us into like first week of December, maybe the second week of December if we have to count holiday time in there. With Labor Day and Thanksgiving, etc. So Pam Yoakum feels like CMS will provide us an answer the first or second week in December. Well, when are we supposed to make a decision for a January 1 start date? By December 17th. So I feel like if we all go through some of these next steps, we can all alleviate a lot of stress for us in this next 6 weeks. Until January 1.
So we have, like I said, have this contact list of contact information. So on here we have the acting administrator for Centers for Medicare and Medicaid. We have his email address and his address. We have the U.S. Secretary of Health and Human Services, her contact information, and her assistant's contact information. That's the information contact person Pam Yoakum gave us to contact with her concerns. the Bureau of Policy Coordination, and then we put in there Governor Terry Branstad's phone number, and then Senator Pam Yoakum's phone number, email, and again, address in there. So we've also attached an example letter for those that may not have the time to write a letter themselves. So we kind of came up with a template of potential concerns that you could share, and then we are going to email them to everybody. So what you could do is just fill in the name, sign your name, email it off to these people. And the more information of the unreadiness of being not smooth transition, I feel like the better that this is going to do to stop this, or at least slow it down. I won't say stop, but slow it down. Again, just to reiterate, to update your current address and stay informed. So we actually have signed a petition. It's this nice petition that is an electronic version. I've shared it on our Facebook page. So if you actually go to our Facebook page, they want, I think it's stated 1,000 to 5,000, I can't remember the exact number, and then they're going to give that to Pam Yoakum to then bring to Centers for Medicare for all of the people. And then just, again, contact Unified Therapy Services with any additional questions or concerns along this way so that we can help navigate through this process.
So just to reiterate what Sarah said, so there's a lot of contacts. You don't have to contact everyone on that list. If you have 5 minutes, I would contact Andy Slavitt at CMS, because again, this is CMS's decision of when they will approve the change.
So if it's like some medical association or University of Iowa, they can't pick more than one MCO.
Oh, great question. So yes, they can definitely, and they actually suggest everyone to pick all 4.
The providers.
The providers.
The
Yes.
providers,
Yes.
we can be in network with
All
1,
4.
2, 3, 4, or 0.
Okay.
Yep, so they're probably in the same exact boat as us, reviewing the provider manuals, and again, not signing to try to halt.
I was just curious, I mean, because there's
Yeah.
a big facility.
Right,
they
exactly.
Multiple insurance companies,
Yeah.
they would sign with multiple.
Even a small provider can choose all 4.
And it's too bad that people in Dubuque don't get together and kind of all favor one instead of everyone kind of stay.
Yeah, we are legally cannot sway anybody's decision on what MCO that they have, but we can tell you who we're in network with. Once we do assign with someone or not, so that could probably tell you one thing or another.
From reading the packets, do any of the MCOs not have caps like the 60 sessions for a
No.
diagnosis?
All 4 of them have a limit of some kind, whether it's a visit limit or whether it is the Medicare therapy cap guidelines, or because of now they're requiring prior authorizations where you never had to worry about that with the regular Medicaid. It was just covered. Now you're going to have basically a certain diagnosis code that they will allow and cover. And the problem is we don't know for how long. It could be 90 days, it could be 6 months, it could be for a full year at a time. They're not answering any of those questions yet.
Okay, and did I also hear you say that the consumer choice option for respite, we don't know yet?
Unanswered, yes.
I have came across, and I did read it, I was just kind of skimming for getting ready tonight, but there's one of the companies that mentions consumer choice and respite and, all the waiver stuff. All the rest of them have nothing in their drafts yet.
So is that the reason why we haven't gotten contacted by Viridian or anything like that from our managers, because they don't know either?
Meridian, I will tell you, they are going to be done as of the end of this year.
Viridian?
Meridian Insurance.
Oh, no, Viridian.
Oh, Viridian, I'm sorry.
Consumer
Yeah.
choice.
Oh, yeah,
No,
that's fine.
they don't have it.
I'm a CCO provider, we know nothing.
Yeah.
And that's what I was going to tell you the same thing. So whether they know or not know, or then potentially actually know and can't tell you.
Right.
Viridian
Two.
has said they contracted with all 4. I talked to them also.
They did.
Oh.
They
What
contracted
about
with all 4.
LSI and Hilsendale?
What was your question?
LSI and Hilsendale.
Oh, LSI and Hillsdales?
Yeah.
I know that we just talked to Marilyn Altoff, right, Kelly? At the last meeting for Hillsdales, and they have not signed with any of the 4 MCOs. Currently, right as of last week.
None of the Iowa hospitals have signed. We can confirm that as well.
Well, they're probably not gonna sign until it's out of draft form, correct?
That would be my
Potentially,
guess.
they would potentially
Yeah.
sign,
Potential.
because it would be not in their best interest to sign before it's out of draft form. So we're not gonna see.
Like, people were just notified in May of this possibility of a change, and the next thing they know, it was sitting on their desk and doing it. So that's why they're all up in arms too, because they're losing their jobs. So like my case manager and
Yeah, my son's
They
case
just got
manager
away.
left.
Where are you from?
Here in Dubuque, my case manager is out of Clinton. For
Oh,
my
out
waiver
of Clinton.
services.
Okay.
I haven't heard anything from Mark.
Yeah,
so-
my case manager moved on. My son's case manager, she left. I'm here to let you know.
There are some leaving.
There are some leaving. I think it's because the MCO still haven't made up their mind. Do they have enough case managers already as employees to handle this? Do they need to hire them? Are they gonna be from Iowa? Are they gonna be from wherever?
None of them are based here. The only one that's based in Iowa is United Healthcare, and they're down in Moline.
And if this doesn't get enacted, then we just don't have a bunch of case managers at DHS anymore.
I think if it gets pushed back,
They'll rehire them.
they'll have to do something. They'll have to hire a case manager to continue to fulfill the needs until it is implemented.
But that's another additional question that I feel like we should write down.
So Medicaid was giving us all these services for free almost, most of it. And now we have to end up paying for some, in some cases it may not be even covered.
That's why it's getting much cheaper.
Yeah,
Right,
exactly. Exactly.
So, and with the Medicare cap or the Medicaid cap, so I know AmeriHealth and AmeriGroup are following the Medicare cap for therapy cap. So let's just say, what's the specific cap?
And it's different because it's occupational therapy. It's a dollar amount. It's $1,940. So once you meet that $1,940 for occupational therapy, then you have to justify why you're getting services. And they can pay or they can't pay. I mean, they haven't made that decision yet.
And there are some exclusions.
There are.
There's some diagnoses that are under exclusion diagnosis
Right.
that we just providers throw on a modifier to
Right,
submit the
to
claims
submit
in.
to get them. And then they currently Medicare combines physical therapy and speech therapy together in one cap of 1940. We don't know if the MCOs are gonna do that same thing, or if they're gonna keep them all separate, or how they're gonna do that exactly. But that is something that's in their draft version right now,
So
so.
with our personal one, our first health insurance, they were covering the 60 sessions until they found out there's a diagnosis. Is that the case also with these?
Potentially, yes.
It hasn't been for us. My daughter has Ehlers-Danlos and she's going to have therapy for life. And she got the 60 sessions in
And she's done.
September, and boom, she's done. And our doctors have wrote to Medicaid, our doctors have asked if she has continued therapy because it's the only way that's helping her. And nothing.
So that diagnosis wasn't on the auto exception for
No, we've looked
Our own-
at precedent. And I just talked to Jen Zelaznik today, and she said they heard nothing back from Medicaid about it, nothing.
No. And the visit limit is typically a hard maximum, so once you reach it, you're done. So if your child comes in for all 3 disciplines, let's say, and you have a 60 visit limit with the MCO that you went with, they're gonna the way we work it is we ask the therapist, hate to do this, but which one is the most important? What do you want them to come in for the most? Because we're gonna give that discipline the majority. If they're all equal, then we literally split it. PT gets 20 visits, occupational gets 20, and speech gets 20. Once they're done, they're done. And then you could potentially be done in as early as May and not get more benefits or coverage until the following year. So, I mean, and we definitely talk to the therapist and say, I know you want them twice a week. Let's not have them come in twice a week. Let's have them come in once a week to try to stretch it out. But that's part of the downfall of it.
Well, that's what I mean, if they're done in May and then you can't come back in until say December, you're basically gonna have to
Redo it all, yeah.
So
Yeah.
you're not making any headway, you're just kind of trying to.
That would be really beautiful to put in your letter.
Which is
On
not possible,
par
I mean, it's
with
like
the
taking kids out of school for the summer. It's
Exactly.
not just back,
Exactly.
they're just relearning what they lost in the summer.
Yeah.
But they are going to lose all the.
It will only extend the therapy
The way I read this letter, which I don't, at least we are asking some questions about the providers and other things. But the biggest concern is, are they going to cover all the everything?
Right, and then, and we don't know at this point yet.
So even
Well,
these
what
things
was
should be
nice
asked.
for members before is that it was almost an ease that you knew that potentially you would not receive a bill or anything from your provider or be contacted saying services aren't covered. Sorry, your services are covered. So now potentially you're going to have to actually read these manuals, your benefit handbook from the MCO you choose, and
And we don't know how detailed they will be either. So they may just say, oh yes, physical, occupational speech therapy is covered. And they may not go into the details. I mean, we don't know until we actually see, what's gonna be in the completed and finalized provider manuals to be able to tell you too, so.
So as much feedback as you can give, as many questions as you can ask. You say it's covered, endlessly. Are there limits? Are there exclusions? Being an advocate and asking those questions, or having us help ask those questions. If you need to know the wording, what do I say? How do in the insurance world, how do we word that? When we're calling insurance companies right now and
There's
asking
keywords.
yeah.
so I know that they're going to be coming out with a comparison chart between the MCOs with insurance benefits, but I think what we'll do, because I'm not sure how detailed theirs will be. Again, if you're on our email list, if you signed up, get on our email list, and then we'll probably create our own comparison list directly for, speech and occupational and at least physical therapy here, telling you if there's a copay, telling you if there's treatment plans, telling you about the visit limits and the specifics on ours. We'll do that work for you and then provide you with that cheat sheet.
Could you, this might be a way of kind of getting around this, I don't know, can you bill like our private, so let's say my private insurance is 45 sessions in a year, and then the MCO is 60. Then bill me the copay and then we go.
Basically the way it works, I'll tell you.
I'm not gonna write that one down. There's a
I love that, but the way it works is, so let's say you have a commercial insurance and you have a 60 visit limit. Everything has to automatically go to that primary insurance first. And whatever they don't pay, then it goes to Medicaid as their secondary. And the visits may not always be accurate at the same time, but they catch up. So as soon as your 60 visits are done, if you only have 45 with Medicaid, we would let you know, say, ooh, you're down to 2 visits left with Iowa Medicaid, but you still have ones with your primary. Do you want to continue to come? Because this is what you're going to potentially owe from your primary insurance that Medicaid's benefiting for you. And then we have lots of grants that we can give out to people as well to help hopefully offset some of that too. But yeah, unfortunately, I wish we could start one and then go on to the next, but it doesn't work that way. So
We also wish that there would be a way of stopping this completely.
yes.
We have not found that.
But I don't understand if our doctors don't even know what's going on. How it's even possible, I don't know. I talked to 3 doctors today. I talked to 2 doctors, Dr. White, Dr. Zlaznik at Crescent, and our chiropractor. And they're saying that they're asking them to blindly say, yes, I'll follow you, and they're not giving them nothing. And we're 1 month from that deadline.
I'm optimistic
Yeah.
that
How?
I'm optimistic that it will slow down, that it won't be.
I mean, if you give us a real reason to be optimistic, we're following you.
I'm saying that it will slow down, that it won't be effective.
So, they can't meet their own deadlines to
Right.
send
Right.
out a letter.
Exactly.
Right.
Exactly.
So, CMS needs to approve it. They have a 2-tiered, 2-gate readiness program, is what they're calling it, a 2-gate readiness program. And
So do you know the same as for at least tier 1 or something like that?
those few bullet points that we put up there were part of their
So
tier 1.
they have to first approve tier 1, then go to tier 2,
Mm-hmm.
and then we will know that.
Mm-hmm.
I don't quote me, but I think Pam said some of the other states that Senator Pam Wilkin has been in contact with, that the
quickest this ever happened was 18 months. For implementation.
Well, look at how long it took them to go through this whole Iowa Health and Wellness thing. And we have jumped through hoops for 2 years, and we're still not at the point.
So how does this MC works in other states work? Do you know? Like, do they cover, are the patients they have unlimited health care through the MC works in other states, or do they pay?
They have, each one probably has a different benefit. I know that there is still stipulation, exclusions and stuff within their managed care options.
And each state is different. So like Kansas and California, they were in a different place than where Iowa is. Every state, Medicaid is federal dollars that then goes to state dollars. And every state is different with their, Medicare is federal, Medicaid is state. So every state that has done this isn't exactly in the same exact spot we are budget-wise and service-wise and education.
And legislation and coverage.
So I got a question, kind of an unusual question. We have a small business that we travel out of town 6 months out of the year. My concern is, right at this point right now, if I'm out of town and I need to see a doctor, I can call them up and say, where can I go? But I have heard some rumors that that's not going to be possible.
We will ask that, but I strongly believe
If it's
that.
an emergency, I can't imagine that they would not cover it.
Right, just like your
To get you through until you can get back home, I definitely would think that they would cover that.
just like, and majority of the commercial insurance out there right now that anyone has would cover if you were out of
Well, I've
town.
been through numerous experiences where they didn't pay at all, and then I called and then they just wrote it off basically, which I don't like to do. And so that's my one of the biggest
Right.
concerns.
Yeah,
Especially if I don't have any animals.
yeah.
Difficult.
And I'm not saying that there won't be an appeal on the provider's end potentially, but I think what they said in the meeting that we went to, because that question got brought up as well, is that, if it to call and just say, hey, I'm out of town, I'm going to see so-and-so, Mercy Hospital in California. And then as long as you call IME services, I think they'd somehow put a note in your file to then make those services go through. So that way, if you almost pre-certify your emergency services, just like if somebody's going into whatever the pre-certification is.
Most providers will call for you too, so if it is a true emergency and they aren't in network, they want to get paid too, believe me. So they will call and go, most of them will go out of their way to say, hey, we're seeing her for, X, Y, Z.
I've never experienced that.
Never.
I tell Debbie all the time that Unified really take care of their patients with verifying benefits for them.
I will go to the
Yeah.
depths
Yeah.
to get you guys covered. Believe me, you have no idea what goes on behind the scenes, but yes, we go above and beyond trying to get everything. So you don't have to owe anything because I don't want to owe anything and I don't want to write it off for our company and they should be paying. I'm tough when it comes to it. I don't take no, it's not going to be covered. Okay, bye. No, that doesn't fly with me. So
Yeah, that's why, again, when she was talking about the visit limits, to say, yes, Unified will say, we only have 2 visits left. We got to be careful. We only got 2 visits left. Where other larger corporations, large hospitals, I'm sure you're not going to get a phone call saying, hey, you only have 2 visits left. You're going to get either those 2, you're going to get a bill. That's why it's highly suggested to now that you guys have to be informative on those manual handbooks.
I think what you guys need to do is for those patients like my daughter who needs lifelong visits, is to have some sort of DVD with your expert care, where they can, when they lose their visits or when they're in
I have often said that.
so they can actually follow you guys at home, either that or online.
I have said that about lots of different insurance companies. If we could videotape our patients so you could see that they truly need services, you would not be denying them services.
Well, first of all,
On a
my
technicality.
daughter's been through physical therapy in numerous different places, and this is the only place she wants to go. that's just because you guys are so awesome. But even my husband recently just started physical therapy and he wanted to go someplace else and he said, no, you can't. So, we would appreciate at least that suggestion being taken in.
Yeah.
We want to bring our patients and let them hang out in the offices of the people that do the decisions for the day.
You know, we've never tried that before, and maybe with the patient's permission, instead of sending them a letter of appeal, we'll just give them a DVD of saying, your notes are in here, watch it, and then see what they do with that.
I think that would encourage, like my daughter, for instance, I'd much rather have her come in here and work out because I know she's doing it. I know she's being encouraged. So if you had a DVD of your therapist or whatever saying, okay, we're going to do this today, we're going to do this today, then she would be more apt to say, okay, I'll watch that and I'm going to do it, to be encouraged. I think lots of kids, especially younger ones, need that encouragement.
Yeah.
People's questions get answered. Do you feel like you're going to walk away understanding the confusion? Confusion came in, but now you understand why there's the confusion.
I don't understand it. I still don't understand it. It makes no sense to me why they would start this program.
Yeah, I still don't understand why they're making this change.
It is very fast. And here's the thing, too, that got brought up in another meeting. Sorry to reference all the meetings, but someone stood up and said, I hope that this does get delayed in the process because Medicare therapy caps, the exception to policy has been extended and extended and extended all these times. ICD-10 has been extended and extended and extended. I'm not sure if everyone knows, but we had certain diagnosis codes ICD-9, and then they wanted to change to ICD-10. Well, that got delayed and delayed and delayed. Well, now she said, I think that's horrendous that you're making that this is a hard deadline of December 17th for people to choose when all these other things that have gone through CMS took forever, and now this is so important to members that now you're forcing this deadline when you're still sending letters out late and not changing, and then member meetings are being canceled and rescheduled, and people are being told wrong different answers. So I think there's a lot on the side of this is not ready.
So what do you have on the Facebook?
On the what?
The Facebook.
Oh, the Facebook is actually the petition that's going to be sent to Pam Yoakum. So if you go to our Facebook, there's actually a little link where you can log on to sign the petition.
Yeah,
What date was that?
The petition, I just sent it
I think it was
yesterday.
So I think it's Sunday.
Okay.
Okay.
This isn't to slow this down.
Yeah, I'll reshare it again.
So we can still sign it?
Oh, yes,
Or-
yes,
Oh, okay.
yes,
I didn't know
yes,
if you.
yes.
Yep. Okay.
How many signatures do you need for this?
It was either 1,000 or 5,000. I can't remember. I know it was either one of those two numbers. But that's what they wanted.
Have you guys gotten options?
We have received all of our requests from the MCOs wanting us to sign with them. And at that point in time, this was maybe 2 or 3 months ago, when we got the information, we had nothing,
They just wanted us to blindly sign them.
blindly sign it.
That's what I'm hearing from my doctors, too, so that's why I'm
Yeah.
asking, you guys have had options, because it makes no sense that they're asking doctors, okay, follow us, but we're not gonna give you anything.
Yeah, right. We have
And
no,
my doctors have also, they're not signing nothing, though, they've got clear-cut stuff on the board.
yeah.
So that, I just.
And we don't know when that's gonna be. Right now, every manual is in a draft form, and we're not sure when the finalized,
I just
final.
can't see all
is
that
gonna be
happening
done.
in a month's time.
Not for all the providers that, yeah, no.
I mean,
We'll
for
have a
a
better chance of not
What
having
is
it
your
happen
deadline, or is there no?
if you contact CMS.
We don't have one right now.
You don't have a deadline to sign.
Just,
I didn't know
just,
there
I mean,
was
as,
Well, I'm not saying that, I'm not suggesting that you do, I'm saying,
Have they
could
given us a
that
deadline?
prompt them to freeze it because they aren't getting people, or is there a deadline that you guys have to sign by so they can?
There's no deadline. I mean, I guess if you wanna consider June 30th,
Yeah.
not really a hard deadline, but fact that reimbursement will remain the same to us through June 30th. That's not, there's no formal paperwork saying we have to choose a method.
So potentially if very, very few providers, maybe even like some, not even any in a certain city sign up, can they really roll this out?
No.
That's what we were
CMS
told.
cannot.
No.
So it's gotta be a certain percentage of providers, is that what it is?
Yes.
Okay.
Across all, there's
The whole state.
a ton of different providers, from OBGYN, to therapy, to, surgery, to DHS, to respite care. I mean, Iowa Medicaid providers aren't just, physicians and us. We're talking all different kinds of Iowa Medicaid providers. The nursing homes, absolutely.
So they cannot assign you to an MCO like
No.
they can the individuals.
Right.
That's your choice.
Now, I use Medicaid as a secondary health insurance. Is, if I do what she suggested, if I apply once Lola reaches 18, do I have to apply then for her own Medicaid, or does she want to be on health insurance, or?
Again, that is a great question. I don't even know if the MCOs have even addressed
They
that.
probably haven't even addressed it, to be completely honest with you.
So can CMM actually give the okay for this in the next month, even if very few providers have signed up?
No, that's
Not
part of
according to
their-
what we found out
That's
about the
part of
readiness.
their readiness.
So if you guys all delay it past their deadline of December, whatever, then you got it.
That's
So
fine.
that is kind of the deadline essentially for delay.
So, we
Yes,
asked-
to find out the answer to
We
the
asked that
problem.
question as well. So originally when I said, CMS said that they would kind of give an answer in 90 days from the date it was submitted. It was submitted to CMS right around Labor Day, September 1st. And CMS said, we are going to read through this and be prompt, but we want to give ourselves 90 days. We asked Senator Pam Yocum yesterday, so what if December 4th comes and that's been 90 days? And they said CMS could approve it, they could halt it, or they could say they need more time to review the readiness to make sure that Iowa is ready to handle this big change. So although Iowa Medicaid is saying all this is happening January 1, CMS they're the final say. So they can take as long or as short of a time as they want and need and feel. That's why it's so important to let them know that.
Any other questions that anybody has that wanted to find out more information? Or kind of looking to get any other questions that we can ask for you?
I got a question, kind of a question for now, is that if our doctors have said to Medicaid, this child needs to have more PT, why wouldn't they respond at all? Our doctors have called 3 times, or rolled those 3 times. I thought that my understanding was you guys have tried, and there's been no response ever.
When I called, I was told flat out, there was nothing I could do. She's pregnant, and there's nothing that a provider can do.
I just don't understand why they can't answer.
Yeah, and that I don't know. I mean, I know the girls that this is Iowa Medicaid. She's
So
on
I
Iowa
would
Wellness.
She's out of health involvement.
And I know when we call in, not to put anybody down, but a lot of the customer service people that we're dealing with don't have a lot of the answers. So a lot of times they're having to go up to tier 1, and then tier 1 has to go to tier 2, and so it's a huge chain, that they have to go through to get an answer. And I don't know where the buck stops, because at some point nobody ever gets an answer. And it's like, you just dropped the ball. I mean, what's going on? And then we call again and we get the exact same stories. Well, we'll go to so and so. It's like, okay. And so our hands are tied too, because.
So I get that, I'm not
Yeah.
saying about you guys, I'm just saying, I don't understand.
I don't, yeah. I don't either.
Hopefully, I mean, I'm hoping that this new system that takes place is better than that.
Yeah.
I'm praying.
And I know they, in the meetings as well, they highly suggested to say if there was an answer that you're unsatisfied with, to please appeal. So if you have reached your max with MCO, let's just say we have Welfare of Iowa, and they say no, you appealed it, they say no, well, they're not the final say. Iowa Medicaid will still continue to be that final say. So besides the Iowa Health and Wellness Plan that I am unfamiliar with, I know she's familiar with it, but besides that, I know that they do have the final say. So if there are exclusions and we feel strongly about it, and your therapist feels strongly about it, where the continuum of care needs to be, then we can appeal Iowa Medicaid again. And also for a short period of time, they will be reviewing, it's called their dashboard. So it's a contact information that, again, I'll send out when we have more information about it. It's a member dashboard where you can call and or send in your complaints or appeals, and so they'll take those under consideration to then potentially change the MCOs.
So we're talking futuristically, not now.
Futuristically.
Which will all take place at the exact same time, because everyone will max out at the same time. Right?
Yeah.
Pretty much.
Yeah.
Potentially.
Yeah.
Right. So I, again, like that, and for providers like us, we love to work on behalf of the member. So I either have you, talk to your healthcare provider to fight for you, and if they can't, then there's no reason why a member can't do that fight themselves. But like I said, we would help you, even if it was somewhere else that you're receiving services, we would be able to at least walk you through an appeal or a provider inquiry form or any of those forms that you'd have to fill out, because she does this on a daily basis.
I know, like with Blue Cross Blue Shield, if they deny something and we try to appeal it, a lot of times members don't know what to do, so there is a form I don't know if that will be the case with the new MCOs, but with Blue Cross Blue Shield, there's a form I can have you sign, and you're giving me permission to talk about whatever I need to talk about to get it covered, and to try to get your insurance to pay for everything. And I do it on your behalf, but I have to have that piece of paper signed before I can even start the process. So I'm hoping that would be the same case with all the MCOs, that there would just be something we could have you sign, and then we can take it over and fight for it on your behalf instead of you having to do it as well.
Well, I don't know how they can do it any different, because when I call my provider to try to do my legwork on it, they told me they can't tell me nothing.
Well,
It's hard.
like we said, Iowa Medicaid isn't going away. They're going to reduce the number of staff. The Iowa Medicaid enterprises will still be here, and if the appeal can go from the MCO to them, right now, Iowa Medicaid looks at our therapy services and requests our notes, and it must be medically necessary, ethical, and we must be showing progress. So, if we can continue to do that in the future, that the services we are providing are medically necessary, and what we are doing together is making progress, I think that is, again, my opportunistic side saying, hopefully, if there are limits and exclusions, etc., we can appeal, and Iowa Medicaid can still be involved. Now, what that's going to mean, unfortunately, is letters of time and phone calling in. Us, the therapists here, writing more documentation, them doing more time on hold on the phone. So, but if that's what we have to do, then that's what we're going to do.
Well, we got 2 geneticists, a doctor, and the physical therapist that's working on my daughter right now, and we're not getting anywhere with that. So, like I said, I hope that futuristic is going to
I'm hoping out. Yes, they will.
We will still be here, but if anyone does need to leave, if you fill out the little half-sheet survey forms, let us know what more you want, what you would want us to do for further parent power presentations like this. We offer anyone anywhere from 2 to 4 a year, and you can leave them just at the front table.
If you guys get more information, we have another meeting like this.
Oh yeah, I was actually gonna say that too. That we could definitely have, because I was gonna say even more, once it gets closer, once things start changing, we might end up having another second session. Yeah, for sure. Yes, yes. Okay, I mean, we'll just, and I'm sure she'll be visiting us sometime. She was just here yesterday. She goes, I'm here. Oh, fine. We just have to bring that in for sure. I know.